All right, good evening, everyone. All right, good evening, everyone. Am I audible? Yes, everyone. Am I audible? How is the audio visual? All right, good evening, everyone. Am I audible? All right. Okay, how is the audio visual? Can you please write in the chat box? How is the audio visual? Yes, everyone. Yes, everyone. How is the audio visual? Can you please write in the chat box? All right, so now I'm starting with 25 questions. So we are going to discuss 25 questions and they are most important. They are very high yielding. I would say 25 topics, right? So we are going to discuss in next few minutes. We'll be discussing few very important topics, right? Now, First question. Yes, everyone. Hello, everyone. Hello, everyone. My hello to each one of you. Hello, everyone. Hello, everyone. Now, question number 1. You have to answer with me. So here what is happening? A patient came to your OPD with symptoms of tuberculosis and chest X-ray is positive whereas sputum is negative. Chest X-ray positive, sputum is negative. So what to do? Should I repeat sputum? Should I repeat chest X-ray? Should I do a CB-NAT? So according to the recent guidelines, the correct answer is CB-NAT. The correct answer is CB-NAT. Yes, very good everyone. Correct answer is CB-NAT. Now quickly let us revise. All the guidelines. So the guidelines say if you have a presumptive TB patient, what is presumptive TB patient? A patient who is not confirmed yet, but all the sign and symptoms, they are TB. They belong to TB, right? Correct? Now, if you have a presumptive TB patient, you order one, you ask to get one sputum and chest X-ray done. So one sputum, one chest X-ray. Yes, everyone, please be with me. This is very important. I will tell you, in the end, I will tell you the importance of this algorithm. Now there are two scenarios. Scenario number 1, sputum positive, chest X-ray positive. This is scenario number 1. Sputum positive, chest X-ray negative. When sputum is positive, irrespective chest X-ray positive or not, we label it as microbiologically confirmed TB. Right? Sputum mein TB aa gaya, need not to worry about. But my problem starts when chest X-ray is positive but sputum is negative. Now, being a clinician, I have a question mark because symptoms say TB, chest X-ray say TB, but not confirmed microbiologically. What to do now? And next scenario is chest X-ray is negative and sputum negative, but still. This is a presumptive TB patient. As a clinician, you are confident about the symptoms, right? So these two things, as a clinician, you are more worried about. In this case, you do one CB-NAT, and this is my question. This is also your NEET 2023 question, right? NEET 2023 question. Very second important point. If you are preparing for FMG or you are preparing for NEETPG, this discussion is very important, right? This is very important. NEET 2023, this was asked. This scenario which I gave you, NEET 2023. In FMG 2023, they asked that you have a presumptive TB patient, and that presumptive TB patient is HIV positive. Now, if you have a presumptive TB patient who is a HIV case, you need not to order. You can directly CB naught, right? So this is your FMG 23. This is your FMG 23. Now, okay, fine. Till here, clear. Now, second point. If on CB naught, it is positive. But if it is not detected on CB naught, if it is not detected on CB naught, now you have two options. Number one, make a diagnosis of clinically diagnosed TB, right? There are many scenarios. If you have discussed my class, if you have attended my class, I discussed a scenario with you where, irrespective of anything clinically or irrespective of any other report, we gave clinical diagnosed and started the TB treatment, right? Now second point, second point, if TB detected, now what to do? If rifampicin sensitive, rifampicin resistant, rifampicin intermediate means it is, we are not able to make it whether it is rifampicin sensitive or resistant. Now you do CB naught. Now you repeat CB naught, right? Now you repeat CB naught. Again, after repeating, if it is again intermediate, then you do line probe assay. This is very important. Okay, done. Can I go ahead? Yes, guys, please write in the chat box. Is this algorithm clear to you? This is very important. Can I go ahead? FMG 23 question, NEETPG 23 question. Can I go ahead? Guys, please write in the chat box. Can I go ahead? Okay, very good, beta. Now, coming to next question. According to National Immunization Schedule, which of the following vaccine can be administered to a 10th class student? So if a student is in 10th class, the age will be around 15 to 16 years. Or maybe more than that, right? So here we give only one vaccine, that is TD. Here we give TD. TD is given, right? Okay, superb beta. Very good everyone. Very good, superb. Now done. Can I go ahead? Okay, guys, one thing I want to tell you. Every time I get question, what is difference between D, T and acellular pertussis? What is D, T, whole cell pertussis, right? This acellular pertussis, whole cell pertussis, the difference is this whole cell pertussis gives more side effect like fever, pain. If we are using acellular pertussis component, it has less chances of fever and pain as compared to this, right? Now second query regarding DPT vaccine. The query is, sir, what is difference between DT and TD? What is the difference? What is the difference between capital D and small d? This capital D is a childhood dose, whereas this small d is a adult dose which is given as a booster, right? This is the difference between capital D diphtheria vaccine, small d diphtheria vaccine, right? Vikram, PDF will be given. Don't worry, beta, you are with me. Just listen for 30 minutes. Just listen to me. PDF, these materials are for you. This will be available. Don't worry, right? Is that fine, Dr. Vikram? Now, third question. Denominator for calculating proportional mortality rate. Regarding proportional mortality rate, 2 points I want to tell you. Only 2 points. Point number 1, the formula. Formula is total deaths because of a disease divided by total deaths, right? Or you can say, in a very simple language, you can say deaths because of a disease divided by total deaths. Deaths because of a disease divided by total deaths. Multiply by 100. This is your proportional mortality rate. Second point, it tells you burden of disease. It tells you burden of disease. So what is the correct answer here? Quickly everyone. Here the correct answer is B, total deaths in a year. Now, coming to next one. In a study, we have 500 smokers and 500 non-smokers. And we followed them for 10 years. We followed them up for 10 years. Quickly in the chat box, which study is this? About this question, I'll talk later. But first of all, I want you to write in the chat box which study is this. Okay, options: case control, cohort, ecological, cross-sectional. Very good beta, very good, superb. Sahil, Rajshri, Anvesha, Anand, very good beta. So because we are doing a follow-up, yes, we are doing a follow-up for 10 years. So this is point number 1 regarding this. This is a cohort study. This is a cohort study. So cohort study is a forwarding study, right? We follow up. In cohort study, we get incidence, we get relative risk, attributable risk, population attributable risk. Now coming to the third point, risk ratio. This relative risk is also known as risk ratio. Relative risk, another name is risk ratio. Now beta, look here, yes. Now I'm making a 2x2 table. Out of 500 smokers, 10% developed MI. 10% developed MI. If 500 smokers, 10% developed MI. Very good beta. So if I say, suppose total smokers are 500, if I write E plus, E minus, yes. Okay, if you have learned this thing, 10%, 50 and 1% among non-smokers. So what is relative risk? Yes guys, what is relative risk? Relative risk is incidence among exposed divided by incidence among non-exposed. 50 divided by 500 divided by 5 divided by 500, right? So after solving this, you will get 10. Correct answer is 10. Super beta, very good. Now coming to next. All right, natural history of disease is best studied by. Yes everyone, in the chat box quickly. Natural history of disease is best studied by. Natural history of disease is best studied by. Cohort, very good beta, cohort. So natural history of disease is best studied by cohort study. Natural history of disease is best studied by cohort study, right? Now, okay, what about this one? Which of the following micronutrient deficiency might be the reason in causing the condition? Yes guys, what is this image? What is this? Yes everyone, what is this image? So this happens because of zinc deficiency. This happens because of zinc deficiency. You must have read in your dermatology also. Zinc causes dermatitis, alopecia, diarrhea and diarrhea. But I want to tell you one thing. The one thing is there is one more deficiency. There is one more dermatitis, which we usually see because of a deficiency. There is one more dermatitis. This dermatitis. Now this dermatitis is happening. This dermatitis is happening because of, yes guys, quickly. This dermatitis is happening because of pellagra. What is pellagra? B3 deficiency. And the name is Cazal's necklace. Okay guys, one point I want to tell you. The zinc deficiency dermatitis is a periorificial, right? Around mouth, or around, around the anal, around the genital areas, anal area, there might be rash, right? So these two rashes in PSM, right? So guys, can I go ahead? Yes. Are you able to understand? Can I go ahead? Yes. If you are able to understand, if you are making the concept, can I get some thumbs up in the chat box? Guys, some thumbs up in the chat box. Yes, very good beta. It is sun exposed. Some thumbs up in the chat box. Yes. Okay, TNM staging is a type of TNM staging. Whenever we have some kind of ranking, some kind of order, it is ordinal. So like T1, T2, T3, the patient is increasing severity. The severity is increasing. T3 severe, right? T4 more severe. This kind is ordinal. Another question. There is a patient who is having moderate hypertension. Now what is this? Mild, moderate, severe hypertension. What is this? Nominal, metric, ordinal. Same options. Just a question change. Moderate hypertension. Ordinal. Moderate hypertension is ordinal. Now farmer's lung is due to. So guys, farmer's lung is due to moldy hay. And for causing this, micropolyspora is responsible. It is responsible. This thermoactinomyces secreti, it causes bagasosis. This happens because of sugarcane. Dust. Aspergillus causes compost lung. It causes compost lung. Very good beta, very good. So we have revised. Okay, let us revise another pneumoconiosis, right? Other pneumoconiosis. Silica dust causes silicosis. Coal dust causes anthracosis. What about asbestosis? And last, what about iron? Iron causes, it causes siderosis. Very good beta, very good. Now next one, RDA meets need of. Yes guys, RDA meets need of. Let us understand the concept of RDA, right? So in your biostats, this is a normal distribution. This normal distribution, it is -1 + 1, -2 + 2, and this is median. This is mean, median, right? This is 50%. Suppose 50%. Now the dietary intake which is sufficient for 50%, which is sufficient to meet the needs of 50% population. This is EAR. So EAR 50%. What about RDA? RDA is for mean plus 2 standard deviation. Now look here, this is mean plus 2 standard deviation. RDA is there for the needs of mean plus 2 standard deviation, right? Mean plus 2 standard deviation. Now mean plus minus 2 standard deviation, this is 95%, 95.4%, 95%. Let us assume 95% approx. Now how much percent is left? 5%, right? 5%. Now this is the left here 2.5 and 2.5 here. RDA covers plus 2, so 95% plus this 2.5%, right? So RDA covers 97.5%. RDA covers 97.5%. 3 points regarding RDA. Mean plus 2 standard deviation, 97.5%. Except, quickly, except this formula is for all, except energy. 3 points regarding RDA, very important. Again and again they ask in exam. Human placenta discarded in. Human placenta is discarded in yellow bag. Human placenta is discarded in yellow bag. In white, sharp metallic waste. In red usually we throw rubber, tubings, right? In blue bag, broken glass. In blue bag, broken glass, right? In blue bag, broken glass. Now which is not true for healthful school environment? One class for 40 students, this is true. Light coming from left, this is true. Per capita space is true. Window more than one person, no. It should be 25%. The window area should be 25 of floor area. So D is the correct answer here. Now RKSK. So what is RKSK? RKSK is Rashtriya. It is Rashtriya Kishore Swasthya Karyakram. This is for adolescent 10 to 19 year. Adolescent 10 to 19 year. In this program, nutrition, sexual and reproductive health, mental health, this is taken care of, but not immunization in adolescent. So here the correct answer is immunization in adolescent. In sexual and reproductive health, we have adolescent friendly health clinics. Adolescent friendly health clinics. Under open vial policy, which vaccine cannot be reused if VVM is intact? Which vaccine cannot be reused? So cannot be reused, or in other way they ask you which do not follow open vial policy. Which do not follow open vial policy. Recently rotavirus and JE, because recently JE killed is used in majority, right? JE killed, which is known as Genvac, it is used, right? So among all pentavalent can be used, rota can be used, JE can be used. So what should be the correct answer? MR. MR, we cannot use it, right? We do not use it 4 hours after opening. Very good, beta. Now, pentavalent vaccine can be given up to. Pentavalent vaccine can be given up to 1 year. If you remember, I told you one mnemonic, BRIP. Yes, what is the mnemonic? BRIP. You remember, I told you one mnemonic, BRIP. What is B? PCG, Rota, IPV, Penta, PCV. These vaccines are given up to 1 year. Right? These vaccines are given up to 1 year. Okay. Can you write in the comment box the viral song these days? Viral song before Arjun Valley. The viral song. Yes. I will tell you one more point. If you tell me the name of viral song, I will tell you one more point in the chat box. Quickly. The viral song. MO. So MOA can be given for 5 years. What is MOA? What is MOA? Yes. What is MOA? Measles, OPV, vitamin A. It is given up to 5 years. It is given up to 5 years. Superb, beta. Superb. Right? Love you all. Superb. Can I go ahead? Yes. Can I go ahead? Now. Okay. Which of the following is false for screening test in series? Screening test in series, right? No meme time, only class time, right? No meme time, only class time. Okay, screening test in series. So in series, in parallel. Screening test in series, in parallel. So do you remember the trick which I told you to learn this concept? Do you remember the trick which I told you to learn this? Guys, do you remember the trick? Yes, I have a trick. Sensitivity, specificity, PPV, NPV. The trick is, just remember one thing. In series, sensitivity decreases. Just remember this thing. In series, sensitivity decreases. Sensitivity has N, negative. This N has N. So both N, it means same direction. They will go in same direction. They will both decrease in series. And specificity will increase. Specificity will increase. So P is in specificity and positive predictive value. So they will increase. They will increase. Whatever is happening in series, exact opposite will happen in parallel. Exact opposite will happen in parallel, right? So it will increase, it will increase. It will decrease, it will decrease. Right? Good. HDI does not include. So life expectancy at birth is not considered in HDI. So D is the correct answer. D is the correct answer. Okay, this Kaya Kalp is it is an initiative for Clean Hospital Initiative. Kaya Kalp is Clean Hospital Initiative. B is the correct answer. Now, coming to JSSK, which matching is correct? You have to tell me the correct matching. This is very important. Health programs, very important, right? JSSK, cash initiative under Ministry of Women and Child Development. No, in JSSK we do not give any cash. What we give? Free services like free delivery, free diet, free. JSY is a cash incentive. We give cash incentive, but it is not under Ministry of Women and Child Development. It is not under Ministry of Women and Child Development. HBPNC, prenatal care. No, this is for postnatal care. It is Rashtriya Bal Swasthya Karyakram, where congenital defect identification. Congenital defects. Example of emphysimosis. So we have anthrozoonosis, zooanthropnosis, and emphysimosis. Emphysimosis. Anthrozoonosis means when animal is giving disease to man. Zooanthropnosis, when man is giving disease to animal. Emphysimosis can be shared among both. So man is giving disease to animal, any one disease. When man is giving to animal, yes, bovine TB. Animal is giving disease to man, rabies, anthrax, and schistosomiasis. Right? So A is the correct answer here, which is true for quarantine. Guys, these two terms are important. Isolation, quarantine. Isolation, quarantine. Isolation is done for cases. Quarantine is done for healthy contacts. Healthy contacts. Right? It is done for healthy contacts. Isolation is done till period of communicability, till the time the person can transfer the disease. Quarantine is done till maximum incubation period. Maximum incubation period. Okay, Ankit, what is the doubt here, beta? What is the doubt? They have directly asked, what is emphysimosis? Emphysimosis means the disease which man can give to animal, and also animal can give back to man, right? Like bovine TB, man is giving to animal. Zooanthropnosis, right? Now, validity of yellow fever vaccine certificate. It is valid 10 days after getting vaccine. 10 days after vaccine. Till lifetime. Till lifetime. C is the correct answer here. Right? C is the correct answer here. Very good, Dr. Saif Ali. Very good, beta. Okay, very good. Med student Piyush, Ankit, Karthik. Very good, beta. Sahil, very good. Shweta, bache, HBPNC is a scheme which is home-based postnatal care. In this scheme, Asha worker, she goes to the house and do the visit and check the well-being of the baby and mother both, right? So this is a postnatal. Postnatal means after delivery. But in the question, the option was prenatal, or prenatal means before delivery. So prenatal, HBPNC is not a prenatal, it is postnatal, right? Which of the following is not stored in amber colored bottle? Amber color bottle. Whenever we have a light sensitive, we store in amber color. We store in amber color. Vitamin A is stored in amber color bottle, whereas measles and BCG, they are stored in amber color vial. Dark color का ना, black color का, almost black color, dark color का vial होता है, bottle होता है. But JE is not. Aculturation, in simple language, it is mixing of culture. It is mixing of culture, right? It is mixing of culture. So B is the correct answer. Cultural changes due to socialization. right? Now Aedes is vector for all. Aedes mosquito. I want to tell you few points about Aedes. It is also known as tiger mosquito. It breeds in artificial collection of water. Right? And diseases caused are dengue, yellow fever, but not Japanese encephalitis. This is caused by Culex. Mosquito. Very good, beta. Because white dots. Richest source of vitamin A. Is halibut liver oil. Second richest, cod liver oil. If they ask you another question, richest source vitamin D. Richest source. Again the answer is halibut liver oil. Correct answer is halibut liver oil. So guys, these were the 25 questions in your test today. Thank you so much, and best wishes from DAMS. Best wishes for your exam, right? From the DAMS, team DAMS, right? Thank you so much, right? I hope you enjoyed this very quick session. Thank you so much. Bye bye. Take care. If you have any doubt, right? You can contact me. You can send me message anytime. If you have any doubt, right? You can contact me. Very good, beta. Ready for PSM, right? Okay. Yes, Dr. Saif Ali Khan. Can we go ahead? Okay. Dr. Ankit, memes, please. Dr. Shweta, Niti Aayog is a scheme. It is a planning commission, right? Niti Aayog. Love you, beta. Love you, beta. Vishwajit, love you, beta. Love you too. Right? My best wishes to all of you. May you all rise and shine. May God bless your hard work. घबराना नहीं है बेटा, बिल्कुल नहीं घबराना है ना. और आपने बहुत मेहनत करी है, बस अच्छे से एग्जाम देना है. कोई भी डाउट, किसी भी तरीके का कोई भी डाउट हो, we at DAMS, we faculties are available for you. आप हमसे किसी भी टाइम कोई भी डाउट पूछ सकते हैं, right? Alright, so bye bye everyone, signing off. Bye bye.